Good morning, everyone. My name is Marissa Aho, and I am the Chief Resilience Officer for the City of Houston. And so excited to be kicking off today for Houston Climate Week with this distinguished panel. I'm going to quickly introduce them, and then we will get started with questions. If you all have questions, please start to enter them so that we can get to them as soon as we're kicked off. So joining me today is Dr. David Pearce, the Public Health Authority at Houston's Department of Health and Human Services, as well as Physician Director for EMS and the Medical Director for the Houston Fire Department. Dr. Umair Shah is Harris County Public Health's Executive Director and Local Health Authority for Harris County. And Dr. Robert Bullard is a distinguished professor and former dean at Texas Southern University. He is known as the father of environmental justice. So excited to have these gentlemen with us today. So before we get started, this discussion is on climate equity and COVID-19, and those are all very, but was hoping to get a quick report out from Dr. Pearce and Dr. Shah to provide an update on where Houston and Harris County are in terms of our COVID-19 response. So please, whomever would like to go first.
Go ahead, Dr. Burke, you want to start?
Yeah, I'll give a brief, and then so the city and the county, first of all, and my colleague Dr. Shah and I are, we joked that we were joined at the hip, and we have been for several months now. But quite honestly, we were for a long time before that, working together on many public health issues, predominantly about the stopping the spread of disease, and a whole host of other public health issues, many of which relate to the social determinants of health, and which will overlap a lot with what we talk about today. But in terms of COVID, where we stand is that we are several months into this pandemic. It is still a pandemic. The greater Houston community, and Houston in particular, we've done a good job of driving down the positivity rate, and we've had many challenges along the way, not the least of which being issues with data, which really are a result of, for decades now in this country, we have invested less and less into public health, quite honestly, because we've had great successes with public health over those decades, such that we weren't the most pressing problem. And as a result, we've sort of set ourselves up for the challenges we've had now with computer systems, which are simply unable to handle the volume of tests that come in, communication links that didn't exist that should have, a lot of things which actually, if I could talk for the whole hour about how they overlap with some of the issues we're going to talk about today. The good news is that the numbers are coming down. It's because people are doing the right things and wearing the masks and maintaining social distance. The virus has not gone away. The virus has not changed its behavior. It will take advantage of any opportunity we give it. So we need to keep up with the struggle. Dr. Shah.
Well, Dr. Pearce, first of all, you are always so eloquent in how you frame things. So thank you for that, and thank you for the continued partnership. And he's absolutely right. We have worked through thick and thin over the years, and over the last months, it has been a pleasure to be working with Dr. Pearce in so many respects. I will say that we sent that first health alert out January 9th that went to healthcare providers across the region that said, watch for this virus. And, it's September 17th, so we're 8 months into this. That initial piece was really about watching what was happening elsewhere. And then it was a frenzy of activities. We were confirming cases here locally, and then it was slow things down by staying home. And then we started to see things reopen, and now we're in that additional phase. That's now that we've reopened, we're now looking at the road ahead with flu season. Obviously, we have election season coming up as well as COVID-19 vaccine in the works, and some significant concern about what the fall and the winter will look like when people are indoors with COVID-19. We had a large set of concerns in that June, July, and really even early August timeframe, but really was very much about increase in hospitalizations, increase in cases, and our increase in positivity rate, which was in the 20s, 25%. 1 in 4 tests were coming back positive. And we've been able, as a community, because everybody's been working together, been able to drive those numbers down. We are still in red from the county threat assessment level, which is right above me right there. You can't see it very well, but right there. And we're hopeful. The one main indicator that's keeping us back from going to orange is really the positivity rate, which has been set at 5%, and we're at that 8% mark. And so while we've made a lot of progress, we're not quite there to get us to orange, but we're hopeful we'll get there soon. And with that, I just want to say thank you for having me, Marissa, along with Dr. Peirce, and always a pleasure with Dr. Bullard to be together.
Great, thank you both for that overview. So when each of you think about the intersection between climate equity and COVID-19, what is the first thing that comes to mind? Dr. Bullard, we'll start with you. You might be muted.
Thank you. First of all, thanks for having this panel, and this is great to have Houston Climate Week. When I think of the intersectionality between issues of climate and justice, I think about health as being the centerpiece. And when we talk about climate change is more than parts per million in greenhouse gases. It's also about fairness, equity, and justice. Climate change is climate justice, environmental justice, economic justice, racial justice, health justice, food justice, and you could go on, transportation justice. So if we're to address climate change, we have to look at it from that holistic perspective. And when we talk about that intersectionality with COVID, COVID-19 has brought to the surface so many inequities that were built on systemic racism, and the fact that when you look at health and health disparities and look at COVID, COVID is almost like a heat-seeking missile that's targeting the most vulnerable population where you have all of the underlying conditions. And if we talk about pollution, health, now we know that COVID-19 maps closely with pollution, and particularly PM 2.5. COVID-19 also maps closely with areas that were redlined 100 years ago, racially redlined 100 years ago. And the areas that were most redlined also tracks closely with areas with urban heat islands. So when you talk about climate, heat island effect, you're talking about these multipliers. That's why we have to, when we talk about building that resilience, we have to talk about building it economically, health, racial justice, and spatial justice, because all communities are not created equal. And if you're physically located on the wrong side of the levee or the tract or the east side, west side, then those communities are more vulnerable. So we have to plan for solutions that take equity into account. Thank you.
Great, thank you. And we're going to do a deeper dive into some of those topics that you just brought up in a little bit. Dr. Peirce.
So I think I have a couple of things, and completely agree with everything Dr. Bullard said. So, for decades in this country, we have systematically, marginalized parts of our society in sometimes subtle ways and sometimes not so subtle ways. And so, whether it be COVID-19, air pollution, other communicable diseases, you're going to see that they're popping up in the same neighborhoods. And there's two things that make those neighborhoods, well, there are many things, but a couple of things that come to my mind that make those neighborhoods similar. The common denominator is that these are communities of low income. These are communities of low education. These are communities of food deserts. These are communities of all kinds of unfair playing ground that put the people who live in those communities at greater risk. And because of the social injustice in this nation, we've also populated those neighborhoods with people of color predominantly, and it has fed upon itself. And so and Dr. Bull is exactly right. So we talk about, I think my very first time talking to city council, this was exactly what I pointed out with the council members, that COVID-19 was going to, bring to the surface these social inequities. And that I hoped then, and I continue to have hope, that instead of just saying, oh my gosh, here we go again, perhaps, and maybe I'm a little Pollyanna, but perhaps this time in America, we can recognize and accept these facts and move forward to change the situation. COVID-19 is not going to go away anytime soon. So we have an opportunity, trying to find the half full part of this. We have an opportunity here to capitalize on this pandemic to make some greater changes. And so that's what pops to my mind first.
Great, thank you. Dr. Shah?
Well, this is always when you're the third person after two folks who speak the truth about any question, Dr. Bullard and Dr. Peirce. I don't have a lot to add. I will say that, we know that this is a global phenomenon. Our concern is that there are global health inequities that are not just about what's happening in this country, but around the globe. We operate the Refugee Health Screening Program at Harris County, and it's the largest in the state of Texas, but I will tell you a lot of what's happening across the globe and really climate-related changes to the environment that really then lead to everything from conflict to people seeking food and having to move in other directions or areas. That very much has impact because those very people are now resettling in our own communities, and we're hearing their voices. And I think that that's that global perspective, but the local perspective is really around extreme events and extreme emergencies like weather events that Dr. Peirce and I are oftentimes, whether it's heat, as Dr. Bullard mentioned, or it's hurricanes or what have you. I mean, there are some significant events that really drive this. And then we have to remember, even in COVID-19, that this is a zoonotic disease, right? It jumped from animals to humans and bats to humans. And largely our environment is impacted by the real concern around what are we doing to our environment, and are we getting closer and closer to animals and invading in their environments. That oftentimes then means that we are now seeing diseases that jump from the animal population to the human population, and like COVID-19, we simply don't have immunity because we've never seen these. These are brand new diseases. So I think there really is a lot that comes into play here, not just the marginalization, as Dr. Peirce mentioned, but also the resilience, because communities that are marginalized, and we're seeing it play out in COVID-19, simply just don't have the ability to bounce back as quickly, or all of us being able to do Zoom meetings. Not everybody can do that. So it is all that in one that comes to mind when I think about climate and health.
Great, thank you. So one of the things that comes to mind for me is around our disparities in life expectancy. And so Houston, Harris County has a life expectancy disparity of 24 years, depending on what neighborhood you're from, and that's before COVID. So how did we get here, and how can we work together to start to eliminate these disparities? Dr. Shah, let's keep with you.
Well, in our we had released a report last year called Harris Cares, a 2020 vision of health in Harris County, which highlighted that 24-year life expectancy gap, which, by the way, is the largest in the state of Texas within a county, which is horrific if you think about it from that standpoint, that just your zip code has more to do with your health than your genetic code. And that is something that really talks about the real concerns around both the structural and social determinants of health. But I want to focus on the word determinants. These are determinants. That means that they actually determine health. These are not factors, loosey-goosey kind of sort. These are determining factors. These are determining elements. These are determining contributors. These determine our health and our life expectancy. So that report actually highlighted a lot of things that we can do together, a 10-year roadmap. But I think the key message is that we have to work together on those determining factors, social and structural elements, if we really want to have impact on health, and it's well beyond healthcare, unfortunately.
Yeah, for sure. Dr. Bullard?
Yeah, I think as Dr. Schott said, zip code probably is the best determinant of health and well-being. Where you live can impact your health, and the fact that all zip codes are not created equal, and there are certain things that are placed in certain neighborhoods by design. In other words, you can design a neighborhood and create that built environment that can have external implications for good health: parks, green space, bicycle lanes, grocery stores, walk trails, and all the, you start naming all the things we know will make you healthy. And then you can, on the flip side, you can also design and start to place certain non-residential amenities in certain areas that to create these pockets of unhealth because of the built environment: landfills, incinerators, chemical plants, all kinds of pollution that's located, or polluting facilities located across some schools and playgrounds. And so when we talk about place, who gets what, when, where, and why, we're talking about how place can get place can somehow be stigmatized, that somehow the idea of put it over there, and that putting it over there of locally unwanted land uses can impact people's health. And so when we talk about the disparity between one zip code from another zip code, or one census tract versus another census tract, it is not, this is not natural. So we can make sure that we don't create these unequal areas. And I wrote a book called Residential Apartheid: The American Legacy. It's looking at place and race and the whole idea of outdoor apartheid. In other words, some areas basically have more of the things physically that make you healthy and determining outcomes that are good outcomes, and others that can push you in the other direction of making people unhealthy. And so when we talk about those unhealthy outcomes, it's very predictable. Now we have GIS, we can map almost anything today. And so we do have tools and systems to make those changes. The problem is, do we have the commitment and the will to do it?
Yes. Dr. Peirce?
So a couple of things come to mind when you talk about this. So one of the things that we've done some research on actually has to do with air pollution. And air pollution obviously impacts climate change. And we look about the areas. We did a number of studies. We combined our EMS database with the air pollution database. And Houston has a very extensive air monitoring system because we have so much industry and so much source of air pollution. We found that with 3 different disease processes that are probably contributing to the disparity in lifespan. And what we found was that in those neighborhoods that have certain air pollution problems, and we were able to define what those are, we found increased rates of cardiac arrest, all right, heart problems where people needed their hearts stopped and required CPR, and 911 was called for that, strokes, and asthma requiring emergent care from the paramedics. And what we've been able to do is recognize the neighborhoods and the air pollution patterns so that we can now predict. In fact, we have a situation where with the HISD school nurses that it's a 3-day pattern of ozone and nitrogen dioxide. And when we are at the end of day 2, and looks like day 3 is going to have that same pattern, we then in the morning of the 3rd day, we notify the HISD school nurses that they're probably going to see an uptick in their kids, students with asthma. So they can then greet those kids as they come in and kind of screen them, see how they're doing, see how the breathing is. Many of the parents have provided the school nurse with some of the medications that are prescribed for that child. And we've been able to go ahead and get a little bit proactive. But the point is that, and the same thing with the cardiac arrest. And here's the other thing we found out is that those cardiac arrests that we believe are related to being triggered by the air pollution, they're in the same neighborhoods that have the lowest rates of bystander CPR. So we went into those neighborhoods and we went to all the houses of faith and we explained the situation. We partnered with the American Heart Association, and nearly every one of them offered, and their ushers, if you will, became CPR instructors to then turn around and teach the families of that congregation how to do bystander CPR. But the point is that we've been able to link critical healthcare problems, which contribute to a reduced life expectancy. We've been able to relate it to air pollution, which, obviously is clearly linked with climate change. We've tried to do what we can, but there's still a lot more work to be done.
Definitely. So I want to stick with air quality for a moment. There was a report released by Burke earlier this year showing emissions reductions due to COVID-19, folks driving less. How can we use changes in behavior or infrastructure to improve air quality and mobility at the same time? And what lessons can we learn from this COVID-19 time related to health impacts? Dr. Bullard, we'll start with you.
Okay, I think it's important that we understand that studies that are looking at human behavior and reaction to certain types of conditions that may cause us to drive less or to stay home or to whatever. In 1996, when we had the Olympics in Atlanta, I lived in Atlanta then, and we couldn't drive our cars for 2 weeks. We had to ride MARTA, and air quality was better. The traffic was less traffic, less congestion, and 36% drop in asthma hospitalization. So when we talk about one behavioral change can have ripple effects. So if we talk about climate and talk about reducing air pollution, and climate change will, if we do less and less, we're going to have more bad air days. We're going to have more in terms of it's going to get hotter and hotter. So I think we have to plan for having cleaner cars, a cleaner in terms of having better public transportation that's efficient, affordable, and greener. We also have to talk about lowering the emissions in terms of our industrial operations, and it will have a multiplier effect. And as we ratchet down the levels of pollution, the impacts will accrue disproportionately in a positive direction to those communities that have the highest concentration of asthma hospitalization and deaths. African American children are 10 times more likely to die from asthma than white children, and adults, Black and brown adults, that is African Americans and Hispanic adults, are 3 to 4 times more likely to be hospitalized for asthma than white. So when we talk about cleaning up and greening up and making our society much fairer, it creates a much healthier society for all. And I always say that when we protect the least in our society, we provide protection for us all.
100%. So we have a lot to cover, and so I'm going to jump to another factor that's already come up in our discussion this morning. In August, the city worked with Harris County Public Health, the Nature Conservancy, Burke, and more than 80 volunteers to conduct an urban heat mapping campaign. And this week, Houston's climate impact assessment was released, showing climate projections, including longer summers, higher heat days, and longer heat waves. How does urban and extreme heat impact the equity and the health issues that we're talking about today? Dr. Shah.
I was hoping you'd go Dr. Peirce on that one first, since there was a lot of Houston there, but I'll jump in. And, I do want to give a lot of credit to our county leadership as well. Obviously, city leadership, not taking anything away, because I know Dr. Peirce is going to mention that. On the county leadership side with Judge Hidalgo and our the Commissioners Court members and their teams, they've really embraced this real notion of what does resilience look like, and resilience not just from a infrastructure standpoint, but a human capital standpoint, and really making sure that we're thinking about things like the SVI, the Social Vulnerability Index. And we know that a lot of this really plays into exactly what Dr. Bullard just mentioned, is really about that there are many communities within our larger, fantastic community that we have as Harris County as a whole that unfortunately are just not benefiting and just not able to enjoy the the real benefits of what what all of us see as not just for ourselves, our families, and our children, right, our next generation. And we have to keep our children in mind. And everybody has the absolute right to optimal health. And what I wanted to say along with that is that this is really, at the end of the day, unfortunately, when you talk about heat and increased heat, and you talk about individuals or families or neighborhoods or communities within that larger community, that will have the untoward impact of that. And so, while maybe some in our community might be able to go to a mall or might be able to have their own air conditioning, not everybody can do that. And so those very conditions that are within our own homes, and I mean homes in the everywhere from not just a house, but where we live, where we learn, where we work, where we worship, where we play, that those real place matters, that is going to impact, unfortunately, communities that are just not sharing in the benefits as all of us believe should be for all of us. And that's what public health ultimately is about. That's what population health is ultimately about. But that marginalization is going to have significant inequitable impact on communities within our larger community. And that's what this issue really brings to light.
Fantastic. And I went with you first because I think the urban heat mapping was a great example of the city and the county working together on a project to get better data for everyone. But now I'm going to put Dr. Peirce on the spot.
Thanks. I get so absorbed in Dr. Shaw's answer, I got to remember what I was going to say. So, but the one thing is that one thought that come to mind when you were Marissa, when you were asking the question was you can't manage what you don't measure, and so it's one thing, and gosh, we've done this so much in this country, is to just sort of look the other way and find something else to focus on. Then I'm glad that the task force got together and put the report out, because now we have some facts, right? And let's face it, this is a time in America's history where the truth and facts are kind of hard to identify from one time to the next, right? From one minute to the next, but that's what you have to work with. And so as climate change continues, and I believe I heard this morning on the radio as I was coming in, there's, I don't want to get political, but Scientific American for the first time ever endorsed a candidate. And one of the reasons that they chose to do that, they've never done it before, is that the number one topic apparently this morning, according to Scientific American, is eclipsing COVID, is climate change. So the timing of this broadcast is perfect, but they pointed out, and this is probably because we have so many storms in both the Atlantic and in the Pacific, that I don't think that, I would like to believe that the world cannot ignore what is going on. And so, it's a global event, but we also are looking at it from a local standpoint. And certainly, I don't know that if the city of Houston were to go ultra green today, that I don't know how much of it would certainly have an impact on those people in the neighborhoods we were just talking about, but it's not going to change the number of hurricanes next year. But we need, not only for Houston to go ultra green, we need for the entire planet to start moving in that direction. And I'm fearing we're about out of time. We need to get moving. So anyways, I don't know if that answers your question, but those are my thoughts.
Yeah, thank you very much. So what I read this morning was about climate change and mental health. And so, with climate risk increasing, depression and anxiety can be triggered. These impacts were felt by many in Houston after Hurricane Harvey and other flood events. And now COVID-19 is also exacerbating, mental health concerns. What can Houstonians do to address mental health related to climate or to COVID-19, and frankly, take better care of themselves, their families, and their well-being? Any suggestions?
Let me just, as a sociologist, let me give a sociological answer and try to connect things that are converging right now. These multiple threats and the mental health impacts that it's having. And if we look at from a standpoint of environmental justice, communities that historically have borne the burden for pollution, overburdened with flooding, overburdened with lack of having basic infrastructure for grocery stores, supermarkets, parks, etc., and disasters. And whether it's the hurricanes year after year, the same communities get flooded over and over. The same communities when accidents happen, explosions happen. These are the same communities. So you have that stress of these acute, and you have these chronic events. So many of our communities are experiencing right now PTSD. You add on top of that the police violence that we see these videos on televisions of these horrific killings, and so then you look at the fact that in many cases today, environmental regulations are being rolled back, healthcare is being attacked, voter suppression is happening all around. You have COVID-19. There are very few services today that one can go to that can tap into all of that, and so that means we have to, in some ways, in many ways, educate our informal institutions and our informal networks, whether it's faith-based or whatever, local neighborhood associations, civic clubs, etc., to really start to delve into mental health and to talk about counseling and talking about trying to build resilience and trying to make sense out of all of this. And so I think there's some community-based organizations now that are being funded to do this kind of work. We have a project that was just funded through the Houston Endowment to deal with these information hubs, these community hubs, to work on these impending kinds of threats that's happening at once. And I think there's opportunity to build out intergenerational collaborations to work on these issues at the local level, and ultimately to work across the region, because there are a lot of issues in the same cities, whether it's Houston, New Orleans, or Pensacola, Gulfport, and Mobile. These are communities that we have projects in, and they're experiencing some of the same things right now that we were experiencing. And so they got climate issues, they have similar kinds of health issues. So we have to collaborate, we have to work together, and hopefully we can come up with solutions that are derived from the communities, and they can speak to, talk through, and try to deal with some of this, some of these mental health crises that's been forced on them.
Yeah, that's really important. Dr. Shah or Dr. Peirce?
I was just going to add to what Dr. Bullard said. Dr. Peirce and I have heard from one of our colleagues, Dr. Austin Shah, twice actually this week about COVID-19 and mental health. And I think Dr. Bullard brings up all the points that I would bring up, and just add to it that there is this real notion of what he called and David, you might have it better, the plane effect, that when you get on a flight and the flight attendant tells you, if we lose cabin pressure, make sure when the mask comes down, you put it on yourself first before you put it on your child or someone else. And I think it just reminds me that you cannot give out of an empty well, which is what my parents always taught me, is that you have to really work to re-energize yourself as you are also working to help those around you. And you have to keep track of both, because you just can't, we're human. And when Dr. Bullard mentioned acute stress and chronic stress, we know that both of those have different elements of impact on the body, and your body in the holistic way of physical, emotional, and spiritual health and well-being is a very important component to how then our body, even physiologically, and the hormones and different things that are released with chronic stress. And that's why we know that individuals that are in communities who are oftentimes impacted by health inequities have chronic stress that really does impact their overall health. because of just their zip code, as we talked about earlier. So I think there is a lot to this, but I also want to recognize that we have to really make sure that we're also respecting our own families and our children and our neighbors, because ultimately, if we take care of those that are around us and everybody does the same, then we're ultimately taking care of our community.
For sure. So wanting to focus a little bit more on taking action. And so the city's climate action plan and Resilient Houston strategies provide roadmaps for climate mitigation, climate adaptation, equity, and inclusion. Much of this work is focused on having all partners at the table and all Houstonians take action and proactively address some of these great challenges that we've talked about today. What specific recommendations do you have for individuals if they want to, you know, if they've heard this call to action and want to do more? Dr. Peirce?
Great. I was anticipating that. I figured it was my turn. So actually, you know, as you're asking the question, Bruce, I'm thinking you're probably the best person to answer it. But what I'm going to say is that my specific recommendation for every Houstonian, I think every one of us has a, you know, our life situation is a little bit different from one person to the next. So I think that the global answer, if I can give one, is for every single one of us to step up, accept the fact that this is real, and what it is within your life, within your family, within your occupation, whatever you work, wherever you live, whoever you spend your time with, you need to do something. So if that means switch from the gas guzzler, great big huge pickup truck that burns diesel to an electric trucks, which are coming out, then switch to an electric truck. I mean, every one of us can do something tangible and real to have an impact. And, you know, I can't remember who it was that said, but, you know, I'm going to mess up the quote. I'm not even going to go there. But the point is, if we want to, you know, see change in the world, then every one of us has to do our part. You can't. I guess my point is, you can't expect the next guy to do it. Don't expect the government to do it. Don't expect the mayor to do it. You got to do it. We've got to do it. I've got to do it. And I can't solve all the problems. Whatever I do is not going to reduce the number of hurricanes next year. But every bit that I do helps. Just like the flip side. You know, yesterday we had the thing about the litter. You know, the mayor brought a thing about the, you know, the amount of littering from in the city now. Well, you know, every piece of trash that's on the sidewalk, somebody put it there. So somebody else picks it up. Well, how about if that somebody didn't put it there in the first place? How about if that somebody, next time they bought a car, bought something that was cleaner fuel? You know, you pick it. But I guess what I would ask every Houstonian is just look within your own life, find that thing that you can do it. And then, you know, 3 months down the road, find another thing that you can do.
Fantastic. Thank you.
If I can just add one thing to what Dr. Peirce said, if you don't mind, is I don't want to undervalue this point, but I think it's an incredibly important one, which is we have an incredibly important election coming up in November, and it's T-minus 6 weeks from now, and we all have the ability to vote as well, obviously if we're eligible, and we should exercise that right to vote. And that means that, as Dr. Peirce mentioned, we also have a responsibility, if we feel strongly enough that we want to take on these activities as a collective, that we should also be thinking about what those policy decisions are as we're getting into the booth to vote. So not to say how people should vote, but just a reminder that voting is incredibly important activity and action that we should also be underscoring the importance of.
Yeah, I just add to that, that if we look at the plan, it is a plan, but how it gets implemented and how it gets made real will depend on communities, organizations, NGOs, civic clubs, homeowner associations, PTAs, it will depend on those entities outside of government that will hold the government accountable for the plan and set up the benchmarks as to how soon those benchmarks can be met. And I think it's important that we build into that idea that we have intergenerational organizations and entities working on this, because this is something that will take all hands on deck approach. And so that means if we are building out a plan from community to community to community and connecting the dots, it'll mean that in order for it to get realized, we have to have a democratic process. It cannot be an elitist, know everything thing from the top. It needs to be grounded up, and so that we can have a solid foundation to have this initiative last longer than a mayor's term or city council term, and look at the long view, that this is something that needs to happen, and the urgency of getting it right and making sure that we're not cutting corners. We're not putting up artificial roadblocks to keep certain groups out just because they may have a certain point of view. I think we need to be open, transparent, and it needs to be a process that is inclusive. I think if we do that, then we have a good chance of getting to that North Star. And I'm hopeful and I'm optimistic.
Fantastic. So one of the ways that we're going to move forward that we've talked about is the importance of everybody getting involved, but the importance of partnerships. So I don't want to put you on the spot to call anybody out, but who else needs to be invited or re-invited to roll up their sleeves and get to work? Are there particular groups, sectors, what is top of mind for each of you?
Top of mind for me right now is that just how our entire community has been impacted by COVID-19. And so I don't think we need to have an a priori, maybe thought process that assuming that if somebody was involved months and months and months ago, that they're in the same place where they are today. We've all been impacted, and our community has been impacted. And I think it's important for all of us to really make sure that we are rechecking in with those very groups that were involved previously. One, because many may not have the bandwidth, and honestly, some may have more bandwidth depending on what's happening. The benefit of being able to at least have some meetings which are virtual is that it has saved a lot of the energies of going back and forth to meetings, which can be spent on, I know it's been hard for Dr. Burke and I in particular have talked about this, where it's Zoom or Teams after meeting after meeting after meeting after meeting. There is no break. It's not even a moment. It's just, but the benefit is that you can actually pack in a lot more because we're spending a lot more time effectively focused on issues and not necessarily the transition or transit between those conversations. So I would just say that we should keep in mind that a lot of folks have been, everyone's been impacted by COVID-19, and just re-engaging everyone in that, with that in mind, I think is important as well.
Yeah, I would agree. Dr. Burke or Dr. Bullard, partnerships.
Well, I would say, I think it's important, without naming names, I think it's important that we surface Invisible Houston. I wrote a book 33 years ago called Invisible Houston, The Black Experience in Boom and Bust. I could put another title on it, but the community that really oftentimes is overlooked, they're not, they don't come to mind at the top of the top 10. But again, I think those entities have value and they need to be valued. And I think there needs to be a vigorous outreach effort to uncover those invisible entities that can contribute to this whole process. And whatever it takes to do that, to be inclusive, to me, that's a top priority, so that we're not going to the well, to the usual suspects, for lack of a better word. So that means expanding the tent and making sure that we are including young people. In some cases, young people that are not even old enough to vote, but they are energized today. See, there's a lot of things that's going on that we just can't do it like we used to do it, Houston. So we have to really reach out and bring in those young people, and include them in the planning and in the leadership, so that we can make that difference. Every social movement that has been successful in this country has had a very strong youth and student component that's been the tip of the spear, that has pushed the envelope further than my generation, baby boomers. So that's what I would advise.
I agree with the young people. Dr. Purse.
So, I don't know that I've got a very insightful answer, but something's been sort of like in the back of my head. This doesn't go directly to this question, but it occurs to me that part of the mental health question comes, we need hope, and we need truth, and we need faith, and we need somebody to believe in. And so it's difficult today because the media is clearly, in certain media outlets, are clearly biased one direction or the other. Dr. Shaw and I been sort of commiserating about, we used to have great faith in the CDC, and now the CDC is coming under tremendous political pressure. So when we talk about partners, I want a partner who I can believe in, right? If I'm just an average Houstonian, I need to know who's going to tell me the truth and not their truth. I need to know the real truth. And so I don't know that I'm answering your question very well at all, but we do need to find that source of somebody out there that I believe is telling me the truth.
I very much appreciate that answer. So I wanted to quickly get to a number of the comments that our audience has made, and many of them have to do with constrained budgets. So just in terms of how do we tackle all of these issues, given that there are constrained budgets, given that it's a challenging time. What would be your advice?
So I'll jump in on this one because that's a really difficult question, and I'm fortunate in my role as a doctor with the city. I don't have a budget. They don't give me a budget, so I have to live off the fire department's budget and the health department's budget, where there are budget people. So I'm probably the least qualified. But my point is that I think it's important that we do recognize budgets are important, and at the end of the day, when tough decisions are made, the final decision makers have got to consider the finances that are around it. And so, to the degree possible, as we look to positively impact our climate, we need to recognize that it's going to need to be done in a cost-effective way, which means research, right? And so, look where we are in terms of electric cars today. I grew up watching, the Jetsons, and I now have this, I now have my cool walkie-talkie cell phone thing that I saw in the futuristic movies. I don't have my flying car yet, but we need to invest in these sorts of things to, and to get there, because at some point, electric power will be cheaper than oil power. Solar energy will be cheaper than fossil fuel based, and biofuels. So there's lots and lots of stuff that's out there. I think that's where we need to go. The budget's a reality. We need to invest in the future today.
Dr. Shaw.
Well, just adding to that, the collective power of our communities is absolutely critical to what Dr. Purse just said, is that it really is that if we can have policymakers across the globe to really look at investment, as he so nicely said, investment in these systems, that ultimately helps all of us, especially in these very, very trying, difficult economic times. But we can't forget that there's a short game here, but there is this incredible long game right now, which is about, as we do, and we will eventually get past COVID-19, not there yet, but we will get past it. But climate and health, or climate change, is still going to be that existential threat to all of us, and we have to keep that in mind.
Thank you. Dr. Bullard.
Yeah, I think it's important when we talk about investments, infrastructure and research, we also talk about investments in social infrastructure. In those, some people might call them soft investments, but I see them as major important investments in our organizations, our institutions, to make sure that they are functional and that they are working and that they have resources to collaborate, community university partnerships, partnerships with government, to community partnerships, and so that the capacity for organizations, NGOs, and community-based organizations can do community-based participatory research, do policy work, can assist government, can assist planners. And I always say we should never leave planning just to planners. We need to bring in the community. And so it means that social investment will need to have the same level of priority and the same level of planning, urgency of now, but also looking into the future. That, I think, having those kinds of partnerships will make for good marriages and good outcomes.
Fantastic, thank you. So I don't think a day goes by where I don't talk about solving for more than one thing at the same time, given the urgency of all of these issues and the importance of them. So I have enjoyed so much this conversation with you all, and sort of on behalf of our audience, want to thank you for your time. To our audience, I hope you were as inspired by this distinguished panel as I was, and I just want to encourage everyone on behalf of the panel and on behalf of Houston Climate Week to take more action. Clearly there's a need. And with that, thank you.